Hi there, this is Dr. Tim Fargo again. I'm here to talk to you about how to detect scoliosis in yourself or a loved one. First of all, please realize that scoliosis can progress rapidly with children. The age of greatest risk for scoliosis progression is 10 to 12 in girls and 11 to 13 in boys. The reason scoliosis progresses in those age groups is that's when, statistically, the spine is growing most quickly. You've probably noticed with kids that in the beginning, when they're younger, when they're juveniles, we got long arms and long legs. Well, those are the long bones are growing first, and then the spine starts to catch up. If you see your child, maybe they're wearing a swimsuit, or you see them after a shower or whatever, and you notice that their shoulders are unlevel, that one of their shoulder blades is sticking out more, or there's a very obvious curve that you can see, or that their waist is unlevel, or you'll see one side of the waist, one side is more prominent, one side looks flatter. These are things that you need to be aware of. There are a couple of red flags that every parent should know, particularly when thinking about scoliosis in children where there's a high risk of progression. One, if you notice a curve that's going to the left in the mid-back, that's a red flag. Curves that go to the left are often associated with underlying disease processes, what's known as pathology. Similarly, curves in the low back that are going to the right are likewise associated. Scoliosis in boys is far less common, and you should definitely pay attention to any kind of curve that you see in a boy, and also if you see any kind of curve in a person under the age of 10, you've got to be very well aware of it. The classic test for looking at and quantifying scoliosis in children is called an Adams test. In the Adams maneuver, which I'll have my model demonstrate over here, the person bends forward with their feet about shoulder width apart. They have their hands together. They simply bend over, and you're looking at the height. Could be between the rib cage, between the shoulder blades, the rib cage, the muscles in the low back. You're simply looking across the body to see if the two things are of the same height. This is the typical thing that's done for a school, an elementary or middle school scoliosis screening. But it's known as the Adams test, and it's very reliable. Another very powerful tool that can be used for detecting scoliosis is an online app called Skullyscreen. Skullyscreen is easy to use. You simply go to app.scolyscreen.com and follow the bouncing ball. What you'll end up with is a score which is highly predictive of scoliosis in your family member or friend. Once again, thanks for your attention. Have a great day.